Hi everyone, welcome to the Houston Academy of Medicine's Food is Medicine series. I'm Susie Laux, Communications Coordinator for HCMS, and I'm going to be your host. With me today is Dr. Louise Bethay, Houston Academy of Medicine's President for 2024. Welcome, Dr. Bethay.
Thank you for asking me to address this important topic.
Absolutely. Well, today's topic is how you can prevent heart disease to help you on your journey to a healthier you. Tell us why it's important to prevent heart disease.
Let me begin with providing some facts about heart disease. Heart disease is a leading cause of death for men, women, and people of most racial and ethnic groups. When you think about it, one person dies every 33 seconds in the United States from cardiovascular disease. About 700,000 people died from heart disease in 2021. That's 1 in every 5 deaths. Heart disease cost $240 billion. Wow. This includes the cost of medical care, medical services, medicines, but also lost productivity due to illness and death. Much of this could be prevented by taking some simple steps to prevent heart disease. These steps could have saved their life. There are significant measures which you can take to ensure a healthy heart. First of all, of course, is no smoking. Smoking increases the risk of heart disease dramatically. Next is something that sometimes gets ignored. Control your blood pressure. The normal blood pressure range is about 120/80, but that, of course, is based on your age. So you need to see your physician to see if you need to either add medications or adjust the medications that you may be on. Next is to control blood glucose. Blood sugar is very important, particularly if you have diabetes, because that increases your risk of having heart disease. Next, control your cholesterol. Your total cholesterol should be less than 170, and your low-density lipoproteins, or your LDL cholesterol, should be under 100. We all know that we need to maintain a healthy weight. That means exercising regularly and eating healthy foods prepared in a healthy manner. It's medically recommended that one exercises, or you should exercise 20 to 30 minutes a day. And then there are some studies that show that 30 minutes 3 times a week is also helpful if you're unable to exercise that many minutes every single day. We need to remember to eat smaller portions. I think we've gotten accustomed to larger portions because of frequently what's served in restaurants. You can do this by controlling your portion size. And then just like to point out that for a meat, a portion that is less than the palm of your hand is really the guide that you need to go by. We also need to eat more vegetables. I emphasize vegetables before fruits because they are low in calorie and can fill one up and are a lot healthier for us. Also, whole grain foods. Maybe you want to take up bread baking. You can produce in your own kitchen some excellent breads, and they're certainly a lot healthier for you than eating bread off the counter in some instances. You can limit your unhealthy fats sources, limit and reduce your salt intake, and many of my patients actually plan their meals ahead and do a lot of the prep work on Sunday. So rather than going out and eating and buying food, they come home and prepare the food that's already partially prepared for them. And of course, exercise. So one thing to think about is, how do I add something to my day? And maybe just getting up 15 or 20 minutes earlier in the morning and take a short walk or a run or even walk on a treadmill if that's possible. It's important to see your physician regularly, depending on the control of your blood pressure or the control of your blood sugar. Adjustments can be made that will help you remain in good health. So your physician may recommend these visits as often as every 3 months or every 6 months or even up to a year. Preventing heart disease is a matter of making healthy lifestyle choices. Remember, making these smart life choices can help you take control of your health.
That's all the time we have for today. Thank you, Dr. Bethea, for the insightful information on how you can prevent heart disease. Now, stay tuned for more insightful discussions and practical tips on how you can integrate healthy eating into your daily life. Together, we can build healthier communities, one meal at a time. Thanks for joining us.